CPR was developed in the 1960s. The American Heart Association recognized this life-saving technique and created a program for physicians to become CPR certified. When helping a victim in an emergency situation, your safety is always the most important. Using protective barriers like gloves, aprons, or even goggles will help create a barrier between your bodily fluids and the victim's. To determine if you need to provide CPR to a victim, first determine consciousness. Do they respond to you verbally? Do they respond to a painful stimulus, such as a pinch or a sternal rub? If not, if they do not respond to this sternal rub or pinch, then they are unconscious. Next, you need to check for breathing and pulse. Listen with your ear while looking over their chest for a raise from a breath. On an adult and a child, you check their carotid pulse with 2 fingers. While checking the pulse of an infant, you check their brachial pulse with 2 fingers. If they are pulseless, you need to perform CPR. Starting with an adult, the correct compression is with 2 hands, one over the other using the palm of your hand. The palm goes on their sternum, and you straighten your arms straight over their chest. On a child, you can use 2 hands, press a little lighter, or you can just use 1 hand, still using the palm. On an infant, for 1-person CPR, you use 2 fingers. If you are performing 2-person CPR, you use both thumbs while wrapping your hands around the infant. The beat of compressions while performing CPR goes along with the song Another One Bites the Dust. So, bum, bum, bum. Another one bites the dust. That's what you do when you're doing CPR. Next is the breathing. To properly give a breath, you need to open their airway. There's 2 different ways to do this. The first is the head-chin tilt. You put 1 hand on their forehead, 1 hand on their chin, and lift up. The second is the jaw thrust remover. You put your fingers by their ear and your thumb under their chin and lift up. This is a maneuver used for spinal injury victims. After you have the airway open, you need to grab the mask. On a child and an adult, the pointed part goes over their nose. On an infant, the pointed part goes over their chin. This is the way that the mask properly fits. They now are making smaller masks for infants so they can fit the right way. A mask protects you from things such as vomit, blood, or water if they were in the pool. The correct ratio of compressions to breathing for an adult and a child is the same for single and 2-person CPR. It's 30 compressions to 2 breaths. On an infant, it's also 30 compressions to 2 breaths, but with 2 people, it changes to 15 compressions and 2 breaths. How long do you perform CPR? That's the question. Well, of course, if they become conscious, you need to stop CPR. Your cycles are going to last for 2 minutes or 5 times through each cycle. After this, you recheck breathing and pulse. If they have a pulse, you stop CPR. If they have a pulse and no breathing, you're going to perform rescue breathing. This is very simple. On an adult, it's every 5 seconds, and on a child and an infant, it's every 3 seconds. So, on an adult, you count 1 1,000, 2 1,000, 3 1,000, breathe in, breathe out. On a child and an infant, you go 1 1,000, breathe in, breathe out. You're not really counting for how many seconds you need it, but it's actually 5 or 3 seconds. When performing 2-person CPR, you can switch instead of getting really tired and stopping. Usually, the more qualified person will be performing the compressions. If they decide that they're tired and they want to switch, they finish off their round of compressions, you give the 2 breaths, and then switch. If you're performing CPR by yourself and you feel like you are going to pass out and nothing is happening to your victim, stop. You go until you can stop. If somebody finds an AED or if there's an AED at the scene when you get there, use an AED before CPR. An AED is very easy to use. You simply turn it on and then apply the patches to the victim. They have pictures on the patches where to apply. Once they are applied, you press Analyze. The AED will give you instructions on what to do. While analyzing, it's most likely going to tell you to not touch the victim. They are analyzing their heart rhythm. They will then either advise or not advise a shock. If they advise a shock, press the shock button. After the shock, your victim may become pulseless again, so you need to perform CPR, or they might get a pulse. Just listen to the AED and its instructions. You can get certified at the American Red Cross or the American Heart Association. I'm certified at the American Red Cross, and they make different numbers than other companies. I know that Augustana offers a 6-week course that you can get certified. A lot of jobs require certifications. It's an awesome thing to have, even if your job doesn't require it. You might be certified and might be able to save somebody's life.